Come on, let's give Cece a big round of applause. That was a little bit more of a workout than we were expecting, weren't we? We're going to work you today. You're going to use those lungs, healthy lungs. You guys, my kids are back here. They might come up, they may not. Welcome, everyone, to the second annual Hike for Lung Health. My name is Ravi Baichwal. I'm with ABC 7. I have the weekend off because I've been doing mornings, which means you really have to exercise a lot to be able to keep up with those hours. But I'm very glad to be here on this Sunday with you. It's going to be a great day. The clouds are burning off. The heat's going to come. It's going to be as great as it was last year. And you all look great. You all look ready to go. And first of all, give yourselves a big round of applause for coming out today. And how about a round of applause for our DJs? They've been doing a great job getting us going. John Holsteiner and Jennifer Ryan of JP Entertainment. Their music, their sense of the mood is great. Now, as John mentioned, I'm here again this year to talk to you a little bit about what this means personally for us. I've actually brought my kids with me. We're kind of hiding behind the stage right here. And lung health and taking care of your lungs as a lifelong commitment is very important in our family because I lost my dad to lung health issues, to lung disease. And who here knows about adult respiratory distress syndrome or something along those lines? And having to live with it, having to take care of someone who has it, to watch vibrant people get taken down, sometimes in the prime of their lives because of this kind of lung disease, and I know there's so many other different kinds of lung disease. Well, we saw it in our family with my father, their grandfather, and it was very, very disheartening to see how someone's quality of life can be taken away the moment that first breath is not being in. You cannot take in that first breath the way you want to. So like Cece said earlier, if you can't breathe, really nothing else matters. So my dad, who was a smoker when he was younger, stopped smoking sometime in his 50s, and actually turned himself into a runner. Still, he came down with lung disease about 20 years later. And so I said I was going to be part of using whatever notoriety I would have to try to move the yardsticks of science so that we don't all have to go through the kinds of pain and the kinds of truncated lives that we certainly felt in our family because of lung disease. So I'm very pleased to be here. I'm very pleased to bring his grandchildren here to share in this effort to make lung health really something that we should all buy into. And I want to thank you for your warm welcome. So, you know, it wasn't just our family, really. In America, 400,000 people, 400,000 Americans are going to die from lung disease in their life. That's a huge number. Some people would say that's a plague, that's a pandemic, that's an epidemic. 35 million Americans are suffering from chronic lung disease. That's more than 1 out of 10 Americans. This is clearly a public health issue, clearly something that we need to be more focused about. So we're happy to be a part of that. And each year, lung disease costs the United States economy $154 billion. $154 billion in direct and indirect costs to the healthcare system. That's a huge number. Despite what happened on Wall Street this week, that's still a huge number. We got to lower that number. So I would encourage you to walk with enthusiasm today, to support the charity partners that are out here as part of it, to tell your friends about this and come back next year because it's going to be even bigger and better. And make sure that you understand that lung health, taking care of your lungs is a daily activity. Try to get out of breath every day. That's what I try to do. And hopefully you'll be able to live a long, happy life with every breath counting all the way. So thank you. Let's now welcome up the President and CEO of the Respiratory Health Association of Metropolitan Chicago, my friend Joel Afric. Joel?
Good morning, everybody. Isn't the weather a lot better than it might have been last Sunday? Nice job to everybody who planned the date and planned the weather. Thank you so much to Ravi Baichwal for joining us. Thank you to John and Jenny, our phenomenal DJs who come out year after year. Thank you to Cece Cowan for the fantastic free mic workout for us. And thanks to all of you for joining us. We have 15 organizations that come together today. I'm wondering if they've got a representative nearby, if they come up so we can just recognize them all as one group. The Alpha One Foundation, the ARDS Foundation, the Cancer Institute at Alexian Brothers Hospital, Chicago Asthma Consortium, Chicago Southside Sarcoidosis Group, the Child Foundation, we're going to need a bigger stage next year. The Foundation for Sarcoidosis Research, HispanoCare, the Illinois Food Allergy Association, the Lamb Foundation, Longevity Foundation. Lamb and Longevity are two of our new partners this year. Mobile Care Foundation, National Lung Cancer Partnership, Pulmonary Hypertension Association, another one of our new partners, and the Urban Sustainability Authority. If representatives are nearby, will you recognize all of our phenomenal lung health charity partners? As a result of their efforts and the efforts by Respiratory Health Association, this year we have raised 20% more money, we have 20% more hikers, and we have a beautiful day for our hike. I'd like to give special recognition to a couple of our top fundraising teams. The Foundation for Sarcoidosis Research has now gone over $21,000 and has almost 100 team members. Jennifer Ferronji, Anjan Chatterjee, and Amanda Negro, I probably punted those names, each has raised over $2,000. Our sponsor, Exelon, which has all these great green shirts, the Exelon hikers, have more than 70 employees, families, and friends that have raised over $16,000. And our good friend Eileen Zaharias with the ARDS Foundation and Jennifer with the Foundation for Sarcoidosis, each one has single-handedly raised over $5,000. They're our top two fundraisers so far. Here. Congratulations. We'd like to thank all of our volunteers, our community walk partners, our sponsors, and I'd like to also recognize the members of the Board of Directors of the Respiratory Health Association who are here today. Kathy Catronbone, Donna Fraunfelter, Doug Graham, Barry Levenstam, Adolfo Mondrigan, Paul Detchen, Cindy Gronkowitz, and as soon as I leave the stage, I know I'm going to hear about others that are here that I just didn't know. Finally, I'd like to thank the special events staff, led by Stephanie Russell for today's Hike for Lung Health, for their hard work in making this a success. They've been out here since 4:30 this morning making sure everything was set up. Please join me in giving them a big hand. And now I'm going to thank our community partners and turn it over to Ravi so we can get started here. Thank you, everybody.